Hello, everyone, and welcome to The Wrap, brought to you by Michigan Medicine Headlines. I'm Dan Ellman with the Department of Communication. Today, June 19th, is Juneteenth. In honor of this important holiday, we will be discussing the context around it and what the organization is doing to help address racial disparities within the community and improve its internal climate. Before we dive into that conversation, you can find all previous conversations we've had on The Wrap. All episodes can be found on iTunes, Google Play, Stitcher, or any other podcast hosting platform. And the newest episodes can also be found on YouTube as we work from home to help the community remain on the downside of the COVID-19 curve. With that, let's chat about these timely and frankly very vital issues facing our communities today. To do that, we're joined by Community Health Services Director Alfreda Rooks and Employee Communication Manager Jennifer Williams. Thank you both for being here. Now, Alfreda, let's start with you. Can you share with us what Juneteenth means to you? And as the holiday gains more widespread publicity, specifically what you see it meaning to the community itself?
So then that's a very interesting question. And as I contemplated this question, I thought about what it meant to me and what it means to me. My family is originally from Birmingham, Alabama, and I can count and trace our lineage back to being able to say that I am fourth generation freed slave in my family. And so it's not so much of a celebration, but it is a solemn occasion and a celebration all wrapped into one, an acknowledgement, number one, that there were still people of African descent who did not know for nearly 2 years that they had been emancipated, that they were free. And so it marks the celebration of that liberation, but it also has, for me, a solemn tone to it that there were still people who were in bondage who did not know that they were free, that they had choices, that they could walk away, that they did not have to stay where they were and be treated the way they were treated. So that's what it means personally to me. But for the second half of that question about what it means to the community, I don't think I'm the greatest spokesperson for that. Only because I can only speak from the perspective of my lived experiences. And for people who are in Texas, who are native Texans, who are of African descent, may see things differently or feel things differently. And so I can only say that it is a recognition, it's an acknowledgement, it's a sorrow mixed with joy at knowing that there was a better tomorrow for people.
Yeah. And I think so much of that is, wrapped up in sort of recent events and hoping for a better tomorrow, right? And I think that we're seeing that internally within the organization too, where it's sort of, the events of the past few weeks have been eye-opening toward what's happening with the African American community and what we can do at Michigan Medicine that can help change that climate. And Jen, I'll sort of focus this question on you. What are some realistic action plans that the organization can take to help change the climate?
Well, as you know, with anything, change certainly starts within. And in order for the organization to change, people in influential roles must look at themselves and they must look at their departments and assess if they're really demonstrating diversity. Hiring people or more people of color, once the freeze is over, is certainly an obvious option because representation in all departments really, really matters. And of course, just putting more people of color in leadership. I think that trainings need to be more in depth on diversity, experiences, real stereotypes, and real disparities. Establishing the employee resource groups to really provide that support and that guidance. And then also when it comes to just resources in general, making sure that everyone is represented. May it be, what may be the norm for a certain group of people may not necessarily be the same for another. So really ensuring that the messaging and the support is truly, truly inclusive. I can speak as being a proud member of the Department of Communication. I believe that we have been and we will continue to use our internal platforms to represent Black people and also all people of color. We have been making sure that we're not only getting those chosen few for photos or videos, but instead like making other connections and really highlighting the great work that other people are doing as well. We're telling the stories of what we will be telling the stories of what the organization is actually doing to fight systemic racism. And I'm actually very proud to be a part of the Diversity Means More campaign. In which we are sharing what diversity means to individuals of our workforce and really highlighting both the good and the bad experiences that people have experienced at Michigan Medicine. I mean, it's our job to keep the conversation going, and in order to keep the conversation going, um, I feel like the organization has to want to change in order for it to actually change.
Hmm. Yeah, and I think we're starting to sort of see those gears start to go into motion a little bit, but obviously it's going to take a lot of work, and it's going to take a lot of work from all members of the
Yeah.
organization, no matter what role you play. Alfreda, I'll direct this now to you. What sort of things, and I know Jen mentioned it a tiny bit, that there are things in important work being carried out at Michigan Medicine to help address systemic racism or racial disparities in the community, not necessarily at home at Michigan Medicine, but in the community where Michigan Medicine resides. Can you talk a little bit about some of this work that's being done, or some plans that are being put into motion that will help
Mhm.
address these disparities?
So I think the first thing that is important to recognize and understand that when we talk about health disparities, most health disparities are linked to the racial disparities of people's lived environment and their experiences. And so, in order for us to address racial disparities, we really have to also look at health disparities, and that's kind of the sandbox that I play in, is looking at what our health disparities are. More than likely, they are negatively impacting our Black and Brown brothers, and so how can we create programming, education that also addresses the social needs that they have, but also those determinants, those environments and community. And so we work from that place. And if I can give you an example of recently, with in the height of the COVID epidemic, pandemic, when we were looking at results, there was a national article that came out about the disparities that we're seeing in the 48197, 48198 zip codes of Ypsilanti, and coming together, working with the St. Joe Health System, working with the Washington County Public Health Department, working with the Racial Equity Officer and the county administrator to put testing in those communities. And so, Michigan Medicine, we ramped up, provided PPE testing kits, and we got volunteers. More than 40 volunteers came out to help in some kind of way with us in those two communities. And so we were able to test almost 400 people during the 3 sites that we held to do the COVID testing and provide some resources for those folks. We did education. If you were negative today, it was important for us to for them to understand that just because you're negative today does not mean that you won't be negative. You'll still be negative tomorrow because you can be exposed. And so giving people that education. The key and important piece of that is that we didn't have them come to Michigan Medicine. We had Michigan Medicine go to them. And so we were in West Willow, and we had people who came who said, "Thank you so much for bringing this to us where we could access it." And that's one of the things that I think that we have to think about is as we're looking at providing services, what are those barriers that people have to accessing that care? And how are we defining, number one, access? For us, most of the time, we define access as wait time, as being able to see the doctor, what type of appointment it's going to be, who you're going to see. But for the community, when we talk about access, it's, do I have to take a bus? Is there one bus? Is there 3 buses? Can I get there? Does the bus run there? If I can't get there, can I afford an Uber? If I can't afford an Uber, where can I get this, or how can I get this? And so it's that as we are making our plans, that we think about the systems and the structures that we put in place that negatively impact people's ability to access the care. And it's not just about having um, a a center that's like in that neighborhood. It's what's also contained in that center. What are the other services that they need that we need to provide for them? And again, making it more accessible. Are they limited English proficient? Do we have interpreters that are there? Do we have materials that are translated in the languages that they understand? Because most people process information in their native tongue. If they're hard of hearing or deaf, Do we have sign language interpreters that are there? If they are visually impaired or blind, are we making sure that the forms that we're giving them are 14 point or larger so they can read them without assistance or without glasses? So these are all the things that we need to be thinking about as we're talking about how we address those disparities. And those are the important things. So I'll stop there because I don't want to. I want to have give Jennifer an opportunity. She's looking like she's got something to say.
No, no, I think I think everything that you said, I 100% agree with.
Yeah. So, who are some of the partners that Michigan Medicine is working with externally to help sort of overcome these, disparities or barriers?
That's a very important point. We have to work in partnership. We cannot do these things by ourselves. And we also need the different experiences or different community contacts that our partners bring to the table to help us craft a broad and inclusive strategy for addressing these issues. And so we work with the Washtenaw Health Department. We work with the racial equity officer. We work with various faith-based organizations individually and collectively. We work with the Washtenaw Health Plan. We work with the Washtenaw Health Initiative. We have programs within community health services that are what I call community anchored and outward facing, that provide that that bridge to the services that we have at Michigan Medicine. So when I think about the work of the Housing Bureau for Seniors and what we're able to do in Washtenaw County, specifically Ypsilanti, about the resources that we have to make sure that people can stay homes, primarily our seniors, that they're able to be age in place and hours at home, because that's very important. Stable housing, when we talk to community, because that's the other piece, that's one of our biggest partners, our community themselves, who we go to and we ask these questions, and they tell us, what is health? When we said, what is health to you? And our senior says, health to us is stable and secure housing, because we know that insecure housing creates stress, creates anxiety. Those things can also lead to additional health negative impacts, both mentally and physically and emotionally. We have our program for multicultural health that works on an individual basis with different communities. With Eastern Michigan, we have a project with them that we partner around family empowerment, where we're providing health education and health promotion to really and truly help with this next generation. We work with community health. Our community health needs assessment is actually done in partnership with the St. Joe's in both Chelsea and Ann Arbor, where we look at from the health system perspective, what are those priorities that we need to be facing and addressing that happens in our community? And so we have three, and they are mental health and substance use disorder, obesity and its related illnesses, and preconceptual and perinatal health for both mother and baby. And all of those things are negatively impacted by racial disparities and systemic racism that's prevalent in our society and in our community, and what those structures do to keep people in those places.
Yeah. Now let's turn back a little bit more internally again. And so, Jen, I'll have you answer this first, but Elfrida, feel free to jump in. In the next 5 years, and in response to systemic racism and sort of the structure that's already in place, what changes at Michigan Medicine do you hope to see?
A lot. I think just speaking also from, what Alfreda said, it's a much larger issue than, what the organization can do. I mean, there's so many different people that you have to get involved, but for me, it's really the hope for faculty, staff, students to be hired and or accepted. As a normal practice and not a box on a checklist or a favor. Because in order for the community systems to change, leadership has to change. And I say that very strongly based on a video. I'm not sure if you all saw, but last year when Van Jones spoke at the DEI summit, he really talked about how you have to have diversity at all tables, because in order to move forward and to excel at what we're doing, you have to have people of all races, all experiences, all different points of views. And I think that in 5 years, I would hope that Michigan medicine can reflect that, can reflect the community, and really begin to dive deep and change the policies and really develop even more and deeper community relationships to both service our internal staff and then also the community. So I think I think we're on the right track, and I think that we have a lot of great people in place right now that are able to push the initiatives and really change for the better.
So I agree with Jennifer, I do, but I think there's for me it's something a little bit more basic too. It's that it's wonderful to write a policy, but how are you holding people accountable to it? And so for me, that means that if we're talking about we are an organization that is based in our one of our values and the tenets of what we're going to do, and our biggest initiative is diversity, equity, and inclusion, then when we have consultants who come in who we are consulting with, then they need to know this is who we are, this is how we're going to be engaged in business, and their team needs to reflect that. So if their team does not have that reflection and not just a token person of color to say we can get this contract, but if their team is not also very much enmeshed and engaged and committed to doing that work too, then that's just not a contract that we do. That we look at what our policies are for how we're hiring, and when we are hiring and everybody looks the same in the department, that there's somebody who's going, wait up, let's have a conversation about this. What are you doing to recruit? How are you recruiting? Where are you recruiting? Because this is not reflective of the population that you serve. It's not reflective of the community that we engage with, and you need to be strong enough and have that voice to say that. I think that we need to start internally within our own departments. What are our hiring practices? What are we doing? What do our teams look like? Are we lazy about it? Do we don't put the extra effort in to make sure that we are exhausting everything? Are there strategies that we're using to make sure that we're using um, blind interview processes and resume reviews so that we can make sure that we're getting the best candidate and not look at Shaniqua's name and go, oh, that's not a person we want to have in our department, you know? But then more importantly, our leadership has to not just talk it, but they have to also walk it. It's about the deeds and the actions that you do. It's, communications puts out some really great stories and articles, but the most important piece of that is, are we really, when you look at that article and you read those words, do our deeds and our actions align with that? Because if our messaging and our actions are not aligned, then in 5 years, we will not have changed anything. We'll still have those same systems that are in place. We need to have pipelines, even for our employees who come in environmental services or the lower paid jobs in our institution, so that if there is an opportunity for them to be educated to become surgical techs, phlebotomists, those careers that we're going to need in 5 years, let's put those things in place right now. Yes, we have a hiring freeze, but there are things that we can be doing right now to prepare us to come out on the other side of fiscal year 21, to make sure that we are moving toward the kind of system where our employees are not relying on food banks for their added sustenance, that they're not walking to work half the way because they can't really afford to like have a car and they've got to walk 5 miles to get to the place where they can get the bus, which luckily you can ride it for free, but you still got to get to the bus stop. So what are we doing to make sure that those who are the least of us in our organization, the least paid, the least educated, that we can help them? Because one of the ways that you address one of the biggest um, factors involved in systemic racism is by making sure that people are educated, making sure that people have a living wage that they can live on, and making sure that people have access to appropriate health care when they need it.
Yeah, and I think that that actually positions Michigan medicine uniquely, right, to have an impact on racial disparities across the region and across the state and across the country, right? I mean, if correct me if I'm wrong, but a lot of times, patients will have better outcomes when they're meeting with physicians or nurses or other caregivers who look like them or who can relate to them and understand sort of what they're going through. And if Michigan medicine doesn't have providers that, and I know Alfreda, you mentioned this, briefly earlier, if there aren't providers who, reflect the population in general and the patients that we're trying to see and we're trying to help, then their healthcare will suffer.
Mhm. But there's a flip side to that, Daniel, and that is that when we have behaviors that are based in racism or bigotry, that we have to hold accountable people for that. They have to be held
Mhm.
accountable. And that if the messaging is this is not what we accept within our organization, then we have to again make sure that our deeds align with that.
Yeah.
Um, Out in the community, we don't have the best reputation because of how we treat people. And partly it's because of that, that people don't often see people who look like them or can't engage with them or understand. And it does indeed make it difficult. The other piece of that is when we are so embedded in the what I call the patriarchal system of medicine, where I am the physician, this is what I tell you that you need to do, this is what you do. And if you don't do it, then you're non compliant. Well, I want to change that language. I want, instead of it to be about being compliant or non compliant, that it is a partnership where the patient is actively engaged in their own health and well being, and that they can have the conversation with that provider that says, look, this medicine that you gave me, my prescription only covers 50% of it, and it's still a $75 copay. I can't afford that. Is there something else that we can do? Having those conversations, and it shouldn't always be about the patient having to educate. It should be the physician being educated enough to engage and have that kind of dialogue with the patient,
Mhm.
to ask those important questions and not just assume because the person chose to either pay rent, their light bill, or buy food, as opposed to getting this medicine, that they're not compliant with what their healthcare provider is saying to them. And so those are the things that we have to work on to really and truly address the disparities around healthcare and health, as well as around race.
Yeah. And I think that also speaks to really changing a lot of our trainings. And, when employees are coming in and being hired, the things that they are, that they're being educated on. I think that's a huge opportunity to really establish new and really more in-depth trainings. But then also that helps change the culture. I know, internally, there are a lot of microaggressions and things that happen from all departments, and I think that once we really kind of put our foot down and people are open to kind of changing themselves, like, we change the culture. We change how, by changing the culture at Michigan Medicine internally, that is also how you can help physicians be kinder and be more understanding with patients, and knowing these health disparities. And it really, I'm such a huge advocate for really kind of looking at yourself and looking at your department and saying, how are we really, really making change within ourselves?
How are we bringing people into the organization? I've been privileged to be part of the medical student Second Look weekend that talks about disparities. And I've been on a panel that speaks specifically about the transgender community, because for years I ran that program for Michigan Medicine. And one of the things that I talk about is that as you're doing this, it's very simple. It's about respect. It's a very basic thing, is respect and listening to the other person. Now, when we listen, though, we listen through our filters. What are our experiences? How was the last time we met a person like this? How did they treat me? All of these things go into how we engage and connect with other people. And so having very open, honest, and respectful dialogue with medical students, with providers, with all of these folks, I think it's going to be very important to changing that culture within our organization. But first, we got to recognize that we do indeed have a problem.
Mhm.
And then we have to be honest enough to say, we don't know how to solve this ourselves. Let's talk to some people and see
Yeah.
what they have to say about how. That's what I call being culturally appropriate for the environment. I don't like the words cultural competency or cultural humility. It's being culturally appropriate, where you are actually engaging in a dialogue as equals.
Yeah, and this is not going to be easy. I mean, it's going to take time. It's not going to take 5 years. It's going
No,
to take time, but what they say, it's about the journey. It's not about the destination. It's about the changes that we're making along the way, to eventually, make this the new norm. Just accepting all people. It will be the new norm, but we have to take the first step, and we have to take it day by day and support one another. And like she said, really making sure that people are educated and that people understand, and really fight for respect. And
Right.
I think that by having those things in place, the journey is going to be long, and it's hopefully it will be joyful.
Right. But there's another piece of that too. We have to give ourselves permission to be wrong. We have to give ourselves permission to get it wrong, which means that when someone makes a mistake, or they send out something that may have been offensive to one group, that we don't get defensive, but we acknowledge what we did and say, what could we have done better? What could we have done differently? And moving forward, how can we do this together? And so it's very important to listen to those things. I'm sorry, Daniel, go ahead.
No, I was just going to say it's a constant learning experience, for everyone. And to your point, it's okay to be wrong. And it's okay if right now you feel like only within the past few weeks you're learning about some of these things. That's okay, And I think that it's important for people to recognize that it's never too late to change, right? And it's never too late to do the right thing. And I hope that today's dialogue may kickstart that for a few people.
Yeah. And keep it going, keep the conversation going.
Mhm.
Yeah. Well, thank you both so much for your insight and thoughtfulness with this. If you want to learn more about Juneteenth, diversity issues, including the recently launched Diversity Means More campaign, go to mmheadlines.org. That's mmheadlines.org. And while you're there, you'll find other newsworthy stories from this past week. For instance, on Monday, the organization announced a monumental gift that will help establish the Elizabeth Weiser Caswell Diabetes Institute. And on Tuesday, C.S. Mott Children's Hospital revealed that it is one of only 24 hospitals nationwide to be ranked in all 10 pediatric specialties, as compiled by U.S. News and World Report. For those stories and much, much more, once again, visit mmheadlines.org. All right, it's time for the weekly trivia contest. Last week, we asked listeners, Michigan Medicine was ranked as the number 15 hospital in the world by which publication? The answer was Newsweek. Congratulations to stenographer Nicole Contreras Rodriguez, who sent in the correct answer. Nicole, a member of the Department of Communication, will be in touch shortly to help you claim your prize. Now for this week's question. Juneteenth is held on June 19th every year in order to recognize what significant event in American history? Once again, Juneteenth is held on June 19th every year in order to recognize what significant event in American history? Once you know the answer, email it to headlines@med.umich.edu for the chance to win a prize. That's all the time we have for this week. Thank you so much, Alfreda and Jennifer, for being here today and for sharing your thoughts. And as always, thank you to all of our listeners and viewers for everything you do for patients, families, and each other. We'll see you next week.